Let's bring in emergency medicine physician Dr. Anand Swaminathan. Dr. Swaminathan, VRBPAC meeting today to discuss Johnson & Johnson's application for emergency use authorization. This is a big one. They are widely expected to vote in favor of it. But what in particular are you looking for? What do you want to hear about this vaccine today and over the weekend as the FDA potentially considers it?
The data that's been released is actually very positive. And I think we've heard a lot of back and forth about the numbers being a little bit less than the Moderna and the Pfizer. But I think the things that we have to stress is we're talking about almost a 90%, 86% reduction in severe infection and no deaths. So we have to keep it really simple. This is a shot that can turn COVID, something that everybody's afraid of, that is killing people, into the common cold. That's what we're talking about. Yes, you might get a minimal infection, but you're not going to get very sick. You're not going to need hospitalization. You're not going to die. And that is a huge win, especially when we look at the fact that this is one shot and it can be stored in a fridge for up to 3 months. That means that we can get it to places that otherwise we've been having a hard time getting to. So this is a huge win, and we really have to play up the zero number, which is 0 deaths with this vaccination.
Yeah. Yeah, Heidi Prisbilla was saying that earlier. I mean, that is certainly a compelling argument. You might get mildly sick, but you're not going to die. I mean, sign me up for that, right? It just is a really strong argument. Dr. Fauci today was encouraging Americans just not to wait to get a vaccine. Here he is.
Right now, get vaccinated. The vaccine that's available to you, get that vaccine. It is important to get as many people vaccinated as quickly and as expeditiously as possible.
So what should people know about the differences between the 2 and hopefully soon 3 vaccines, Pfizer, Moderna, and potentially J&J? And what is your advice for people who right now prefer to get one over the other?
I think, again, the bottom line is that all 3 of these vaccinations are going to lead to no deaths. The no deaths in the arm that got a vaccination, whether it be the Pfizer, the Moderna, or the J&J. That's the thing that we need to stress over and over again. And the best shot is the one that you can get in your arm. So we shouldn't be waiting. If we want to get towards herd immunity, if we want to get to a place where we can start seeing our family again, get what's available. And yes, the J&J is going to be a little bit more delayed in getting up to the numbers that we need, but it's going to be a huge win in supplementing our supply of all the different vaccines. And I think what I have told people over and over again, and I think what most healthcare professionals are telling people, is get whatever vaccine is available to you. Don't be nitpicky, just get what you can get.
Andy Slavitt from the White House COVID response team is asking businesses to get involved by giving workers incentives to go get vaccinated. What do you think of that strategy? Effective?
I think it's an interesting thing, whether it be monetary or something else is up for question. And some people have said this might raise skepticism for those who are already skeptical. I'm not sure that that really comes into play, but it doesn't have to be a monetary bonus. Things that are simple that businesses should be doing is supporting people and taking time off to get a vaccine, paying for travel expenses to get a vaccine. And then as the supply increases, let's look at some other things that we can do. How about turning work sites into vaccination sites, not just for your workers, but for the community in general? And we have some very large businesses that could do this. And that would be a huge boon and would really message to your workers as well as the community that you think that this is safe, it's effective, and it's what we need to do. And then once the supply is really enough, how about an opt-out strategy for people who work in a business? You're going to be scheduled for a vaccine appointment, and then you can choose to unschedule that. We know this is cognitive psychology. We know that if you schedule people for it and don't make them do it, there's going to be a much higher uptake. So how about an opt-out approach to this? Right. There's a lot of ways that businesses can really help out here.
CDC Director Dr. Walensky said today that COVID cases are ticking up again. Both she and Dr. Fauci are saying that we need to be careful or we could see another surge. Take a listen.
Cases have been increasing for the past 3 days compared to the prior week. And while deaths tend to fluctuate more than cases and hospital admissions, the most recent 7-day average, approximately 2,000 per day, is slightly higher than the 7-day average earlier in the week.
If we plateau at 70,000, we are at that very precarious position that we were right before the fall surge, where anything that could perturb that could give us another surge. We don't want to be people always looking at the dark side of things, but you want to be realistic.
Are you worried about another surge this spring or this summer, especially with more new variants popping up?
I think we have to be worried about this. And that leveling off of cases is a big indicator that we have to be more worried as the variants start to creep in and are spreading throughout. And what we're seeing is we're hearing about a lot of governors that are loosening restrictions. And this is not the time to spike the ball. You know, we say don't spike the ball on the 2-yard line. This is spiking the ball at the 50. We can't be repealing mask mandates. We have to keep up with good public health. Keep the masks on. Keep distance. And one of the big problems is with the economy and people talking about reopening businesses. We have to be very careful about this. And we also have to be ready to shut down again or to repeal or reinstate restrictions if that's what's necessary as numbers go up. But we can't be celebrating. This is not the time for us to say that we have won, that this is over. The declining rates are great, but as we see that plateau, we really have to be careful. Another spike again could really destroy us. And as we see these vaccines get to us, the supply increasing, seeing another surge now would really be heartbreaking.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.